Good morning, everybody.
Good morning.
We're ready to get started. We are now recording. So I would like to call to order this public hearing of the Committee on the Judiciary and Public Safety. It is 9:35 a.m. on Wednesday, March 29th, and we are conducting this roundtable virtually and streaming on the DC Council's website and YouTube at CM Brooke Pinto. I am Councilmember Brooke Pinto, representing Ward 2 and the chairwoman of the committee. The Committee on the Judiciary and Public Safety has oversight responsibility for matters affecting the district courts, criminal law, procedure, and justice, public safety, including policing, violence prevention and intervention, and civilian police oversight, access to justice, including victim services and justice grants, fire and emergency medical services, and the district's 911 and 311 services, forensic science, fatality review, and medical examinations, homeland security and emergency response, adult and youth corrections, family law, probate and estates, child support, and women's and gender policy. Today, the committee holds its first hearing in its review of the mayor's proposed fiscal year 2024 budget and financial plan. We will discuss the proposed budgets for the following agencies this morning. First, the Fire and Emergency Medical Services Department, and second, the Office of Unified Communications. We will first hear from the Fire and Emergency Medical Services Department, or FEMS, whose mission is to preserve life and promote health and safety through excellent pre-hospital treatment and transportation, fire prevention, fire suppression, and rescue activities and homeland security awareness. The mayor's proposed fiscal year 2024 budget provides FEMS with approximately $327 million, which amounts to a 3.5% increase over last year. I have questions for Chief Donnelly today about how the mayor's proposed budget will impact the quality of life and safety of our firefighters, service provided to residents, and maintenance of the department's fleet and facilities. There are several activities that were cut altogether and several new activities added to the proposed budget. And I'll be digging into these proposed changes and their impacts with Chief Donnelly today. I am pleased to see a $1.235 million investment to establish a much needed paramedic training program to support the workforce pipeline and provide district residents easier access to these well-paying jobs. I look forward to discussing this program and its timeline in more detail today. Then we will turn to the budget for the Office of Unified Communications. OUC is responsible for providing fast, professional, and cost-effective response to emergency and non-emergency calls in the district. OUC was established in 2005 to combine the emergency 911, non-emergency, and 311 call activities from the Metropolitan Police Department, Fire and Emergency Medical Services, and customer service operations. The mayor's proposed fiscal year 2024 budget provides OUC with approximately $59.6 million, a 2.4% decrease over last year. I'm eager to speak with Acting Director Heather McGaffin about how reductions in the number of call takers and dispatchers will impact service when the agency is already struggling to meet minimum staffing levels. I'm also interested to hear more about her plans for 311 and how the $472,000 enhancement to 311 will improve service for residents. Finally, I look forward to discussing how this budget proposal will support training and quality assurance efforts as the agency works to improve accuracy and build community trust. For today's roundtable, we will follow the committee's normal practice and hear from public witnesses first, followed by our government witnesses. Public witnesses will have 3 minutes to present their testimony, and those who represent organizations will have 5 minutes. So we will hear from a panel of 2 public witnesses today, of David Hoagland from the Washington, D.C. Firefighters Association, and Allison Clausen, public witness. Go ahead, Mr. Hoagland, when you're ready.
Good morning, Chairperson Pinto and members of the Committee on Judiciary and Public Safety.
I'm David Hoagland, President of the District of Columbia Firefighters Association, Local Number 36 of the International Association of Firefighters, AFL-CIO. Thank you for the opportunity to testify today on the FY 2024 proposed budget for the Fire and Emergency Medical Services Department. We appreciate the continued support of Mayor Bowser and her commitment to public safety in the district. Today, I would like to discuss how this year's proposed budget falls into our three key focus areas of staffing, training, and resources. Staffing. In regard to staffing, we were fortunate to have 50 FTEs added in last year's budget, with another 50 planned for this year. Unfortunately, the 50 FTEs for this year were removed from the budget. These FTEs are critical to ensure the department gets closer to the correct staffing factor. By continuing to hire, our overtime costs will come down to a more manageable level, and we will eliminate the use of mandatory overtime to address our vacancies. Training. To address this challenge, we need more dedicated FTEs at the Training Academy for recruitment and training. We cannot continue to pull members from the core mission of this department, responding to emergencies, to staff other divisions of the department. With more FTEs in recruitment, applicants can be processed faster and the department can meet their hiring goals. The training program offered by O2X has proven to be highly beneficial for the department, not just in terms of employee health, but also financially. The program has saved the department over $4 million, as per the 2022 cost savings report that will be attached to my testimony. The O2X specialist teams include a program manager, a registered dietitian, a strength and conditioning specialist, and an athletic trainer and injury prevention specialist, all of whom work together to prevent injury and help injured employees return to work. By integrating this program with the police and fire clinic and the department's own health and wellness program, we have achieved remarkable injury prevention results and reduced re-injury rates. To continue to reap the benefits of the program, we need to include more on-site specialists, which will save the department more money and promote our members' health and well-being. For over a decade, Local 36 has advocated and lobbied for a DC paramedic program. Having it in this year's budget is something we're excited to see. This is a great step towards addressing getting more trained paramedics through a hiring pathway into the district. We look forward to our members having the opportunity to upgrade to the paramedic certification internally. Resources. Maintaining our apparatus fleet is vital. Recent price increases in the cost of apparatus has expanded the need for funding in this area. While funding for this coming fiscal year appears adequate, we are significantly underfunded in out years. The current reserve fleet is not adequate to fill in service gaps when a frontline apparatus goes out of service. If we're unable to meet our apparatus replacement schedule, history shows what happens if we go down this road. It will directly affect our ability to respond to emergencies. The capital budget expenditures include funds for a new engine company 26. The department says this will decrease response times, even though the firehouse is being moved off a major thoroughfare of Rhode Island Avenue. When this project is completed, it will increase an already sizable service gap for aerial ladder trucks in the center northeast section of the city, affecting the Fort Totten, Riggs Park, North Michigan Park, and Brookland neighborhoods, among others. We believe placing Truck 1 back in service at the existing Fort Totten Firehouse will address this gap in service. As a supplement to my testimony, I will submit data from an exhaustive geographic information system study that was completed prior to the pandemic. While the department may tell you that this data is older, since the data was analyzed, our call volumes have surpassed levels that were seen before the pandemic, which makes it even more relevant. Run volume has increased, hospital wait times are through the roof, and couple that with the department's inability to process new recruits along with attrition, we are faced with an overtaxed workforce. This demonstrates the need for continued capital budget expenditures to update our existing facilities and look towards building additional firehouses to increase our response capabilities as development in the district continues and population density increases. The contract with AMR has been helping to address the strain on non-emergency medical responses are placing on our system. Their lack of consistent resource availability continues to place a strain on our own resources. We need to continue to ensure AMR is providing adequate service delivery to our residents and overcoming their own staffing challenges to supplement the department's response. We hope that through continued collaboration with OUC and other agencies, we can address low acuity calls that are placing a strain on our existing resources. While we appreciate the mayor's continued commitment to public safety and the fire and EMS department budget remaining at a reasonable funding level, we look forward to cooperating with the committee to address the issues we have cited. Thank you for the opportunity to testify before your committee, and I look forward to answering any questions you may have.
Thank you so much, Mr. Hoagland. Next, we will hear from Allison Clausen, public witness.
Good morning. Thank you for your time. My name is Allison Clausen. I was born in the district and now live on 20th Street Northeast in Ward 5 with my husband and our 4 children. In addition to being a parent, I'm pursuing a master's in sustainability and I'm a community representative on the Mayor's Urban Forestry Advisory Council. I'd like to express my gratitude to our emergency responders, particularly as we personally benefited from amazing services when our family suffered a house fire in 2011. My testimony today regards the planned relocation of the Engine 26 fire station in Ward 5. Based on emergency response time, FEMS has identified 2 possible sites for the project, one in Fort Lincoln and one in Langdon. I ask that the funding for site selection, design, and construction be provisioned on broader public health goals, namely aligning with the city's Vision Zero commitments and 40% canopy goal. As I live down the street from the Langdon location, I'll focus my attention there. Many of these concerns also apply to the Fort Lincoln site, however. First, the Langdon site poses significant threats to pedestrian safety. For those unfamiliar, the proposed facility will share a site with a senior center and is directly across the street from Langdon Elementary. It is surrounded by homes, and the road emergency vehicles would use to reach Rhode Island Ave bisects Langdon Park, where children cross from the playground to reach the rec center and pool on the other side. In other words, emergency vehicles on these roadways will encounter young and elderly pedestrians daily, whether seniors leaving an exercise class, children at dismissal from school, or a team arriving for practice at the rec center. Inevitably, those encounters will have deleterious, if not tragic, health effects, either slowing emergency vehicle response times or imperiling children and seniors in transit. This exact stretch of 20th Street experienced a speed-related driver fatality just 6 weeks ago on February 3rd. We need to be proactively working to make our roadways slower, but emergency vehicle routing is a commonly cited reason by DDOT for not installing traffic calming mitigations. The council should require that budget approval for the site selection, design, and construction of FEMS Engine 26 be contingent on Vision Zero considerations. Second, developing this location poses environmental health threats. The site is largely forested, part of a multi-acre wooded area that serves as a buffer between the industrial zone and the school, senior center, and neighborhood. The forest absorbs air pollution, noise, and heat generated by the industries. It also filters and absorbs stormwater that would otherwise pollute Hickey Run, an effort the city has already spent $4 million to mitigate. Further, research demonstrates that forested areas increase learning outcomes for nearby schools and improve community, mental, and physical health outcomes. Removing canopy would compromise those benefits and jeopardize public health in various categories. Ward 5 has the most industrial zones, the worst heat island effect, and the most canopy loss of any ward in the city. The council should not approve funding for projects that result in canopy loss in Ward 5. Funding for FEMS Engine 26 should be approved provisionally with a guarantee that existing forest canopy remain intact. I'd like to conclude by sharing my frustration about the lack of transparency around the site selection process for FEMS Engine 26. I only learned about this project because of a public space committee application. The school has not been consulted. The community this fire station will serve has not been informed. It's been very difficult to get information, and the community has not been included. Thank you for your time and your service.
Thank you so much, Ms. Clausen. And I'm concerned when you say that the community has not been included at all. Can you elaborate a little more on what you were just talking about, the public space application, and kind of how you would have preferred to have community input in this type of process?
Yeah, so the process started before COVID, and they applied for a curb cut application. That was the public space application. And they said, we're just applying for this for a curb cut. But buried in the paperwork of that was the curb cut is for a fire station. So it was a really, they had to go to the ANC to get approval for the curb cut. But I would have preferred that instead they went to the ANC and said, we're considering putting a fire station in here. We want your feedback so that we can hear all of the factors about this community. And then I've asked FEMS if they would do a public meeting, and they said it needed to be arranged through MOKers. So I've been working with the MOKers to try to put that in place. But at first I was grateful. I felt like FEMS responded quickly and gave me feedback. But then once I asked for anything beyond just very initial information, the answer was no, not until after we get budget approval. And so we want to make sure that our concerns are addressed within the context of budget approval rather than after the fact when they say, well, it's been approved, so we're moving forward, if that makes sense.
Mm-hmm. Got it. Okay. Thank you very much.
Yeah, thank you for your time.
And Mr. Hoagland, thank you so much for your testimony. And I share your enthusiasm for the paramedics program. I know this has been a long time coming and something you've been advocating for for a while. Beyond what's in this budget proposal, what do you think would be some other useful tools to improve recruitment efforts?
So if we could get additional FTEs at the training academy, that would be, our recruitment staff is working incredibly hard to meet hiring goals, but there's just simply, I think, not enough of them right now to process applicants. So I think twofold, we get some more FTEs down at the training academy to help with the recruitment, and also more FTEs to just help with the training. Because right now, when we have a large class of recruits come in, we pull other FTEs out of our operations division to aid in that training. So if we could get some more FTEs down there to help with that, 5 more captains, 5 more lieutenants, something like that, I think would be really helpful, so that we can continue to try to meet these hiring goals and also enhance things like the paramedic program and other training initiatives we're trying to do through the department.
Okay, so is that the number that you would advocate for, 5 lieutenants and 5 captains?
Yes, I think so. Yeah, and in addition, like I said, to supplementing those other FTEs that we were supposed to be getting in this budget cycle, just in terms of vacancies, so we can hire to keep pace with attrition, as well as just other increases and strains we'd have in our staffing.
Right. Okay. We will continue to work towards that. Thank you very much, Mr. Hoagland.
Thank you, Councilmember Pinto.
So with no further public witnesses this morning, we're going to turn to our government witnesses, starting with Chief Donnelly of the Fire and Emergency Medical Services Department. And as you know, it is the tradition of this committee to swear in all government witnesses who appear before it. Have you here? Okay, great. If I can ask you to take yourself off mute, Chief. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? I think you're still muted, Chief.
It is, and I do.
Great. Thank you. Good morning.
Morning.
I would now like to invite you, Chief Donnelly, to make any opening statement that you may have.
Good morning, Chairperson Pinto, council members, and staff. I'm John Donnelly, Chief of the District of Columbia Fire and Emergency Medical Services Department. I am pleased to testify in support of Mayor Muriel Bowser's fiscal year 24 budget. For those of you watching from home, my testimony is available on our website at fems.dc.gov. The fiscal year 24 proposed budget and financial plan, titled A Fair Shot, reflects many tough choices, and it was formed with an eye towards how we get the best outcomes for our residents at this challenging time. The administration's fiscal year 24 investments are strategic, prudent, and focused on ensuring an equitable comeback for Washington, D.C. We are fortunate that even in tight times, the district remains well-resourced and able to continue delivering world-class programs and services. Before I begin, I would like to recognize and thank the employees of Fire and EMS for their dedication to the service they provide and the sacrifices they make in protecting the residents and visitors of the District of Columbia. This great work would not be possible without the support of our labor partners in IAFF Local 36 and AFGE Local 3721. The hard work and dedication of the 2,262 employees of the department, firefighter EMTs, paramedics, officers, and civilians, has earned our department the title DC's Bravest, which represents the trust that is the basis for the significant investments the mayor has proposed. The fiscal year 24 proposed gross operating budget for the department is just over $327 million, which funds 2,267 employees. This is a 3.5% increase over the fiscal year 23 approved gross budget of $316 million. The mayor's proposed budget is comprised of $260.3 million in local funds and $63.9 million in federal resources. Starting with the local funds budget, The proposed local funds budget includes an increase of 2.7 million and 7 new employees. The following is a summary of our operating budget enhancements. The District of Columbia Paramedic School. This enhancement will allow the department to lead the development of a District of Columbia Paramedic School. Mayor Bowser has committed $1.2 million and 2 employees to support this effort. Our goal is for the school to accept its first students in the summer of 2024. This enhancement is an example of Mayor Bowser's commitment to preparing our residents for solid middle-class healthcare professional careers. This investment solves a problem. A national paramedic shortage is exacerbated locally by a lack of training options and existing paramedic overwork and burnout. This shortage is acutely felt in the district, where the department competes with several large regional jurisdictions to fill paramedic vacancies. Adding to the problem, the District of Columbia is the only state without a paramedic program. This investment will help the department meet its goal of hiring or training 70 new paramedics per year to fill new positions and vacancies created through promotion, attrition, and retirement. Currently, we are only able to hire an average of 30 to 35 paramedics per year. While the department is a built-in demand for paramedics, and we know that we have EMTs who would take advantage of the DC Paramedic School, training in paramedicine provides portable advanced healthcare skills for students. It is both a pathway into fire departments regionally, but also a stepping stone for students to pursue other advanced medical degrees like registered nurse, physician's assistant, physical therapist, or medical doctor. This enhancement will create a DC-based training program in partnership with a district college or university. The goal for graduates is 100% job placement, and for those that have what it takes, an opportunity to join DC Fire and EMS. Other graduates could be hired by surrounding fire and EMS departments, private ambulance services, and local healthcare facilities, or even enter the national workforce. In the coming weeks and months, the department will convene a district agency and healthcare stakeholders to select a willing and qualified grantee institution of higher education to operate the paramedic program independent of the department. The grantee will fund the program through $250,000 in startup cost plus the subsidized cost of tuition. The $250,000 grant would be awarded in fiscal year 24, with the first class scheduled to begin in late summer 2024. Fire EMS will make its state-of-the-art EMS simulation lab available and bear the additional costs for expansion. Fire EMS will provide technical support and separately run a selection process for selected department employees for admission to the program. Our next investment is in fleet maintenance operations. The mayor allocated $1.2 million and 2 employees to supplement the operations of the fleet maintenance program. The age and repair costs of the fleet have increased for a variety of reasons, including supply chain issues and industry-wide delays in manufacturing. The apparatus division requires this enhancement to account for the inflationary costs of repair and maintenance and to hire qualified mechanics to manage the increased workload of older vehicles remaining in service due to the national backlog of ambulance and fire truck orders, which are outside of the district's control. The Fire Prevention Division staffing enhancement. The department will add 3 employees to the Fire Prevention Division to focus on fire code inspection and compliance. There are approximately 24,000 individual businesses in the district that require a fire safety inspection every 2 years. It's part of their business license renewal. To support these businesses, the department needs to conduct about 12,000 inspections annually. The department's inspectors, in addition to their other responsibilities, currently have the capacity to conduct about 6,000 of these inspections. Adding the additional personnel will allow more of these businesses to be inspected to ensure they meet the fire and life safety codes and ease the renewal process. While population growth in the district may have slowed during COVID-19 pandemic, construction has continued apace. New developments, higher population density, and altered existing structures all present a potential fire and life safety hazard to the community. Fire code compliance inspectors help ensure structures are maintained as required and community members are safe. The department currently has 31 inspector and inspector technician positions to detect fire hazards and ensure compliance with district law. There are some reductions in the local budget. The local budget includes a reduction of $382,000 and 5 positions to account for vacancy savings in personnel services across a few different programs. Medicaid revenue allocations is the next part of the budget discussion. In fiscal year 23, the department continues to benefit from Medicaid cost reimbursement for ambulance transport. We recover the actual cost of providing EMS care and transport for Medicaid patients rather than receiving flat transportation fees under this system. This change has resulted in a significant new revenue stream for the district and the EMS system. In the budget book, these funds are shown as grants and more accurately reflect the reimbursement of medical expenses for the provision of service during the previous year. The mayor and the department have allocated these funds to fund several priority investments. First, structural firefighting gear and personal protective equipment, or PPE. The department will increase its investment in the purchase and replacement of structural firefighting gear and personal protective equipment. Structural PPE is among the most critical safety equipment used by every firefighter, providing protection from thermal, physical, environmental, and bloodborne pathogen hazards encountered during structural and proximity firefighting operations. Structural PPE is the primary physical protection for firefighters from exposure to cancer-causing products of combustion. The department provides each member in the operations division with 2 complete sets of PPE. This costs approximately $10,650 for each member. Due to new hiring in fiscal year 24, we expect to outfit up to 300 new members with PPE or 600 additional sets. This is in addition to our ongoing replacement of damaged, condemned, or old PPE. The next investment is in the training academy supplies. For several years, the department has been limited to training about 120 recruits and 25 cadets due to resource limitations at the training academy. Beginning in fiscal year 23, the department committed to train 240 or so candidates each year. This significant increase in the throughput at the academy is possible due to the resources provided by Mayor Bowser to address attrition, which is mostly due to end of career retirements and to help reduce our overtime costs. This enhancement will increase funding for the actual materials and supplies needed to train recruits, cadets, and existing members. These supplies will ensure the delivery of mandated training and improve member safety. Our next investment with these Medicaid funds is some contract oversight for our third-party provider. The department will add 1 new contract specialist who is responsible for managing the third-party basic life support transport provider and Right Care Right Now nurse triage line contract. This enhancement will provide a full-time manager of the contract responsible for transportation of about 40 to 50% of the patients taken to the hospital by ambulance. This is an important initiative to ensure that DC Fire and EMS responders are available to respond to life-threatening emergencies. The new specialist will also assist in the management of the nurse triage line, which is a critical component of reducing the use of our area's hospitals' emergency departments. The third-party provider contract is one of the department's largest and requires a dedicated specialist to ensure we are good stewards of the district's budget. We also believe this additional layer of oversight will improve the availability of life-saving resources for visitors and residents of the District of Columbia. The fourth investment is atmospheric monitoring equipment for our engine companies. This enhancement supports our cancer reduction initiatives by providing multi-gas detection capabilities to all 33 engine companies. These meters will provide an additional level of safety to the members of the department and the citizens and visitors we serve. Multi-gas monitors are essential for first responders to know that the atmosphere they are about to enter is healthy and safe. The department uses multi-gas meters currently on all its ladder trucks and battalion chief vehicles, and these are used to detect oxygen, carbon monoxide, hydrogen cyanide, and other flammable gases. Without multi-gas meters, engine companies must request and wait for the arrival of a ladder truck or battalion chief to monitor the atmosphere. The fifth Medicaid funding item is a shift in funds for the police and fire clinic. The FY24 budget proposal will include a shift of $4.3 million from local funds to the department's Medicaid revenue to support the operations of the police and fire clinic. Now our capital budget. The department's capital budget for FY24 includes funding sufficient for apparatus purchases consistent with the department's apparatus replacement plan. The department continues to invest in fire apparatus engineered and built to provide maximum safety, longevity, and durability. These state-of-the-art vehicles allow for us to provide maximum water flow for building fires, the ability of our ladders to reach our high-rise occupancies. We are purchasing specialty vehicles such as a mobile command unit, mass decontamination units, and new heavy-duty rescue squads to support the Special Operations Division. The department has incorporated green idle reduction technology to conserve fuel, reduce operating costs, improve operator safety and comfort, all while protecting the environment. The department's facilities and capital programs provides funding for small scheduled capital improvements, continued planning for the Engine 26 relocation, and full funding for the new Fleet Maintenance Reserve Facility at Blue Plains. The construction of this facility by fiscal year 26 will allow the department to vacate the existing site at Half and M Street Southwest. Chairperson Pinto, thank you for the opportunity to testify on the department's fiscal year proposed budget. The resources allocated by the mayor will enable us to continue the transformation of the fire and EMS department and continue to deliver high quality services. The council and this committee are critical allies in this effort, and I appreciate your work to ensure we operate a world. I look forward to continued collaboration as we do so. We are available here to answer your questions. Thank you.
Thank you so much, Chief. Appreciate that report and all of your efforts for the department. I want to start with a conversation around staffing, which I know is something that you have been working hard on and something we heard from David Hoagland earlier today. Does this budget support the department's goal of a 1.41 staffing factor?
It gets us closer. The limiting isn't the budget that's assigned, it's our ability to hire, process, and get through it. So we got to 50 employees in this fiscal year, and I think we're going to get very close to filling our vacancies by the end of the fiscal year, and that should help us get to that 1.38, 1.37 mark. And then as we go into fiscal year 25, we should be looking into whether or not we can get to the next level. But I think for this year, we're in a pretty good spot.
Okay. I'm very concerned still about the amount of overtime budgeted. The agency budget includes $22.56 million for overtime pay, which are the same levels as we saw in fiscal year 2023. Is it safe to assume that this budget will not allow the department to end mandatory overtime? In fiscal year 2021 and 2022, FEMS spent over $44 million on overtime pay, and your budget in FY 2024 is roughly half of that. So do you also believe there's sufficient funding for overtime pay allocated in this budget?
So we get to the where the money comes from through a variety of different ways, working with the CFO, the mayor, and the deputy mayor to make sure we have enough money if we get to the point where we're going to exceed the budgeted amount. There's a lot of drivers for overtime, and the last 3 or 4 years have been really different from COVID, through COVID, afterwards, vacancies, and things like that. So while President Hoagland described using people from operations to train people, so every time we have somebody in a training class, there's somebody out of a seat that causes more overtime. That is, as we're running more people through our training academy, we are having more overtime to cost to train those people, and that's a challenge. So I think what this budget does is that we're in a spot where in FY23 and FY24, we should be at the end of these, we should be able to get back to those FY19 levels, the pre-COVID levels of overtime, which is the accurate reflection in the budget. And I think until then, it's hard to predict what it's going to be because of all those other variables and the challenges we've had to face during all that.
Okay. Look forward to continuing to work with you on that.
Okay.
The agency's proposed budget includes funding for an additional 3 FTEs to serve as fire inspectors. I see that right now FEMS also has 1 vacant fire inspector position. Can you speak to the need for these new inspectors and your plans for how you're going to fill these positions?
So when you're looking at the vacant fire inspector, when we have a vacancy, it goes through a process and we try to fill them within 30 days. So that vacancy, I assume, has already been filled or in the process of being filled. Those are internal upgrades. A firefighter gets trained and then becomes a fire inspector. So the additional fire inspectors are important. We talked about the need to do 12,000 or so business inspections every year. We also, in terms of trying to get more help for the inspectors, use operations companies and an inspection schedule to relieve them of some duties in that world. But we don't want to be the holdup in people renewing their licenses. These are important inspections. They make sure that that things like fire exits aren't blocked, that there's adequate fire exits, that the building hasn't changed. When we see tragedies in public occupancies, a lot of times across the nation, they're related to a lack of ability to inspect. Our job is to prevent fires, and we need resources to do that. That's what this investment's for.
Great. Thank you so much. How about for firefighters? Are you on track to reach your hiring goals for new firefighters? And when will the new class of recruits start? And is that aligned with your initial proposed schedule?
So we are on track to do more hiring than we've ever done. We are hoping to get 140 between now and the end of the fiscal year. I think we're going to be very close for FY23. The new process that we initiated during last year of using a rolling register and making our job more accessible to people, a wider variety of people, we're seeing the results we want. We're seeing people that hadn't been able to apply to the district in the past or had gone to other organizations applying to us. We're seeing good, solid candidates applying. So those numbers are good. We still have more work to do with recruiting. The reality is we've given our second entry exam for the firefighter EMT position just this last month. And this is the first opportunity for us to actually target people. So if we show up at a local college and want to talk to the athletes and say, hey, we have a job that gives you an opportunity to serve the community, and it builds on your physical skills, your compassion. They come to us. They're interested. It's opportunities people hadn't thought of before. It allows us to talk to people that may not make it into the cadet program for a variety of reasons, but it puts in their mind that, hey, the fire department is hiring. I don't have to wait 5 years to apply to them. So we are seeing benefits of recruiting. Our numbers are different than the nation. While they're down from what they were when we were giving the test every 3 to 5 years, they are still higher than my peers across the country. So I think this is working. It's a process. We have the next class starts April 15th. We have over 50 students in that. We had hoped to get 70. And some of that's just our process of making sure people's backgrounds are clear, that their driving history is good, that their work history, is good, and working through things like that. But I think we're in a good spot. The class after that slated to start in August, and then one at the end of November, beginning of December. Those classes will go on, and I think we're in a pretty good spot. In addition to it, we are, just for everybody that's listening, the cadet program is opening soon. Check our website at fems.dc.gov, and we will have a cadet class starting in October as well.
Fantastic. Thank you so much. And it's great to hear the kind of earlier in the pipeline efforts that you're undertaking to demonstrate to people how wonderful a profession this is and start building that pipeline out. So I want to talk a little bit about the paramedic school, which I am very excited about and thrilled that the mayor included funding in her budget proposal for this initiative. How will you choose a university partner to work with, and what will that selection process look like?
So we're going to meet with all the district partners that are stakeholders here. and make sure we have the right criteria. We know that whoever takes this on has to be certified to do this. There's something called a COAMP certification. So the university that decides to take this on is going to have to do that. We also want a university that has a relationship already with students, and most of our universities in the city do, because it's feeding. There's multi-levels to a paramedic program. A paramedic program generally takes people from an EMT level to paramedic. And the universities that are working with our high school students already are engaging them in ways where hopefully they can get into one of the EMT programs that exist in the city as a feeder into this program. So we want to hear what the universities have and what they can offer and why they think they can be successful. And, you know, there's an element of cost to it too. If one comes in way over budget and says, you know, we can't do this, the cost is going to be unobtainable for our residents, then that's not going to work, or even my budget, right? So we'll have an element of that as well.
Got it. Okay. And do you know where the new program will be located?
Well, we do know we need it located close to public transportation. There is, and parking or ways to get it there. That is absolutely one of the evaluation factors. You know, it doesn't do it to help us to do it in a place that's landlocked. And if we want to attract students from all over the city, it needs to be accessible to public transportation.
But we don't yet have a site selected.
No, some of the training we expect to take place at our facility at PR Harris, where we run the simulation lab. So we know some of the training would take place there. We do not have the space to house the program, although we will make it available. We will make elements of our space available to support the program. But no, we don't know. And I expect it may be hybrid as well. There'll be portions of this that are hybrid. That's a new learning model. And during COVID, a number of the national or a number of other states adopted hybrid models in training paramedics. So I think there's an element of that as well.
Got it. Okay. And do you have a timeline for selecting a partner?
So it's hard to do some of this without an approved budget. So we'll be meeting, since it made this first round of the budget, we'll be meeting with the DC partners soon to figure out the next steps in reaching out to the universities in the district, universities and colleges.
Okay. What will the staffing requirements be of the facility once we have a location? That's
on the program. This is taught like a college program, right? This isn't going to a room and sitting in a room. There's a series of courses that are involved in this model. It's essentially going to a college. So staffing should, from the university's perspective or the college's perspective, they're going to have to give us the staffing plan. Fire and EMS is going to commit somebody to coordinate the interaction with DC Fire and EMS, because every program needs interaction. And then, since I expect that probably half the students going through this, or maybe even more than that, would be DC Fire and EMS employees, will also need to coordinate and support their activities between work and the paramedic program. So from the fire department side, we're committing somebody to interface with the program. We're committing somebody to manage our students. In the startup phase, both of those people should be able to help whichever college or university go through whatever processes the university and the certification agency require.
Okay. And I understand some of this is still in flux. I'm getting that from the conversations and negotiations that need to take place. But do you have an expectation or hope of how many paramedics you plan to train each year through this program?
So I think a good goal initially is 70 per year. Maybe working toward 100 at some point. Looking around at other colleges, that seems to be about the right level.
Okay, great. So let's talk a little bit about, oh, sorry, go ahead, Chief.
I didn't say anything, I'm sorry.
Oh, okay. Let's talk a little bit about firefighter quality of life. The mayor's proposed budget includes a $1,150,000 cut to the facilities quality of life initiative in the property management division and a $225,000 cut to the procurement of new exercise equipment for firehouses. How will these cuts impact services available to our firefighters and our efforts to prevent injuries and our health issues? And do these cuts include cuts to O2X?
So first of all, none of them include cuts to O2X. O2X is a great partner. President Hoagland was right when he said partnering O2X with the police and fire clinic. Where we've been able to do that is brought people back to work faster and stronger and healthier. As you see, when you see their report and his attached testimony, it's an impressive way they document the differences they do. So O2X is great. There's no cuts there. The other two cuts are a result of, really having to make some tough decisions. And we have exercise equipment in most of our firehouses. It isn't what this means is that we won't replace it with new equipment. So, that is a challenge. It is something that, if we could, we'd like to, but given where we are, I get it. The second part about quality of life is that's in addition to what DGS has spent on our facilities, and what this will require is for us to lean more heavily on DGS than we have in the past. So we'll have to coordinate more with DGS as a result of that reduction.
Okay. The agency's budget chapter includes a decrease of over $8 million to reflect cost savings for fleet maintenance, PPE, medical supplies, and third-party ambulance services contracts. What's the source of these savings? It concerns me on its face that it looks like we'll be spending less on these particular services.
Hang on one second. I'm going to have to consult with my team on that.
Sure, take your time. Yeah. I'm unmuted. Can you repeat the question? Sure. So there's a piece in the budget for an $8 million decrease, and the quote for the source is reflects cost savings for fleet maintenance, PPE, medical supplies, and third-party ambulance services contracts. So I'm wondering what the source is of that $8 million worth of savings for topics that are really vital to the department.
I understand. I'm going to turn you over to our agency budget officer, Frida Resio.
Okay, sounds good. And I'm just going to go ahead and swear you in as well. And if there's anybody else in your team who may be testifying, you can join this oath. If you could take yourselves off mute. Do you swear or affirm under penalty of law that the testimony you are about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
Turn your speaker up.
So,
I'm sorry, I couldn't hear anybody. I think you have to take yourselves off mute. I don't hear any sound coming out. It looks like you're off mute, but I don't know that your audio is working.
I can come to Chief. Can you hear me now?
Yes.
Yes. Good morning. So it's actually a shift.
I'm sorry. I need to
problem.
swear you in. And so I have to, I'll repeat it again. And anybody who's going to testify, if you could say I do, if it's true. Okay. Do you swear or affirm under penalty of law that the testimony you are about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Thank you. Go ahead.
Good morning again. So it is actually a shift of those activities from the local fund side to the Medicaid resources, to the Medicaid grant resources. So it's not a reduction. It's more so of an adjustment to move the resources or the activities from local side to the Medicaid funds.
Okay, and if they're moving into the Medicaid side, will that have any impact on those services themselves, or it's just a budgeting mechanism?
It's a budgeting activity, purely budgeting activity, no impact.
And what's the benefit of moving that activity into the Medicaid side?
It's all to meet the local target that was given for the agency because of, the current adjustment to the local funds, just like the police and fire clinic. Other activities are to move up to the increased revenue that the agency had on the Medicaid fund side.
Okay, that makes sense. Because in the budget chapter, it says this is a decrease related to cost savings. I just want to make sure I'm clear that this is not actually a cost saving measure. It's just a budgeting.
So I believe what it means is cost saving to the district, because at the end of the day, when we switch resources, that fund that would have been used against local funds can be repurposed in the district for other purposes. So it still would be a saving on the local side, since the agency has additional resources on the Medicaid side.
I hear you. Okay, but the services themselves will not be cut.
Yes, nothing has changed. The service is the same.
Okay, thank you so much.
Thank you.
So Chief, will this budget allow the department to purchase personal escape systems for all firefighters?
Not currently. That is something we just got that implemented this year. This budget does not have that funding in there. As we get through the year, maybe some of that will come available. It is something that we know is an important piece to local 36 and management and the safety committee. So it is something on our radar screen.
Is that something that you think is really important for this agency's budget to have this year?
I think there's a lot of things that are really important. I think getting this implemented, seeing what's going on with it during the course of the year with what we've done. We currently have them for each riding position. And we have a supply of extras so that we can do cleaning or training or repair broken parts, things like that. We'll have to see that may be untenable and we have to find a way to do it. But we need to look at the data and see what's going on.
I see. Okay. And how much would that cost about to provide these systems to everyone in the department?
At least another $1 million. It was $500,000 for the investment we made.
Got it. Okay. Thank you so much. Do you know why the fleet management budget was cut by $81,000? This is the lowest funding level that we've seen for fleet management in the last 4 years.
Positions. Is that in the NPS side or the PS side, or do you know?
Let me double
What
check.
you're looking at there? So we've added some funds. We've added FTEs to fleet, and we've added additional funding into the budget with an enhancement from our Medicaid funds. So I'm not seeing an $81,000 deduction. I'm seeing 2 new employees and $1.2 million
Okay, 1 second.
added.
Okay, this is under the administrative support division.
Yep.
Budget chapter doesn't include the detail of MPS versus PS on our end.
I'm going to give you back to the budget officer. She's got
Okay.
me.
Okay, great. Hi. I can't hear you. Still no.
So that $81,000 is a reduction in the amount that DPW believes they're going to be charging us this year. Can you hear me?
I can hear you. Interesting. Okay.
So we pay DPW for a certain amount of money each year for parts of our fleet operation, whether it's fuel or some other pieces. And that is an expected reduction in costs.
Okay. So that reduction is not of concern to you for fleet.
No, no.
Okay. So let's turn now, Chief, to the capital budget. As you know, the agency's CIP includes funding for a number of different projects related to fleet maintenance. Can you speak to how the agency determines the appropriate funding levels for these projects? Does FEMS use a capital asset replacement scheduling system to identify appropriate funding costs?
I'm going to give you Chief Hansen, who's going to go through the way we do that.
Great.
Morning. You hear me?
Morning. Yes.
So for our facilities, we're using, when we do a project, we hire an architecture engineering firm, and they help us come up with the cost of what the cost of the project will be. For our capital apparatus purchases, that's based off of contracts on how much we're paying per year for contracts. Oh yeah, I'm sorry. So the actual replacement schedule is a CARS report, which we use through OCFO. And that helps us come with what we're supposed to be buying on a yearly basis based off of the condition and assessment of all our apparatus.
Okay. And if these funding levels are done on an annual basis, which it seems like they are we seeing significant increases for fleet maintenance in this budget? Pumper maintenance is up, it looks like $45 million across the CIP, ladder trucks by $17 million, and ambulance vehicles by $10 million.
So that is correct. So we have for ambulances, we had a 22% increase in cost from FY20 to FY23. The most significant increase was for engine companies, which was 48%. And then for ladder trucks, it's 42% of an increase from FY20 to FY23. So what we planned for 3 years ago, what we thought the costs were going to be have gone up. It's an issue of supply chain. It's an issue of manufacturer backlog. Just to give you an idea, once we get a PO established, it takes us almost 4 years right now to get the apparatus that we actually purchased or have them design, build, and then we receive it. So we're looking at other apparatus manufacturers. We're engaging with them, trying to figure out what other options are out there. So, but it's really a supply chain challenge on the manufacturer side. We're not the only ones facing this problem. It's across the country. Again, a 4-year backlog of fire truck orders is challenging.
Okay. I guess I'm trying to understand that if all of the planning is going on to consider what these costs are going to be long-term, why is there a reflected increase so much this year as opposed to having been reflected for the last several years?
So a number of our contracts had expired. So we were working towards getting new contracts in place. And so for instance, most contracts in the past were 1 year with a 4-year option. A number of the contracts were in the last option year in FY20 or FY21. It took almost a year to get the new contract established. And then the apparatus manufacturers all had various additional charges for, metals and things of that nature. And they're trying to estimate what it's going to cost 3 years from now when they have no idea what the price of all of that will be at. They have challenges with their staffing as well to find skilled metal workers and people that know how to build fire trucks.
Okay. And how about for the rescue squad vehicles? It looks like these were zeroed out in fiscal year 2025, 26, and 27. will the $2 million allocated in fiscal year 2024 and the $4 million balance in this project be sufficient to cover maintenance costs over this period?
So we have 3 heavy-duty rescue squads and a hazmat unit. 3 of the rescue squads, one is just delivered or is in the process of being delivered. The other 2 are being built. So they'll replace the frontline rescue squads. It'll allow us to refurb the ones that are currently in service. Since we only have 3, we don't need to purchase new ones for a number of years. And with the existing fleet and putting them in reserve status, we felt like we'd be in a good place. And based off of CARS, it's not that we felt like that it was the case. That's actually what CARS is telling us.
Okay. I see some additional funding in the budget for repairs to the fireboat. That funding is $500,000 in fiscal year 2024, and then no funding until fiscal year 2026, when the project receives significant investment of $15 million. Is that first $500,000 intended for design and planning?
Yes, that first part is continued design and planning for replacement of the John Glenn.
And is that design and planning work going to take 2 full years to complete?
Probably, yeah, we think so.
And why is that? Is that common that it would take that long?
So we have never, I mean, that boat is from the 60s. We've never designed one of these before. So common is an interesting way to look at that. It isn't common. And that's why we're being cautious in how we plan for this and get it right. We've had some attempts at this before. And I think getting the right people involved in the planning process, doing the needs assessment of the waterways and what the uses of that will be really important to getting the right boat built so it can last, the new one lasts another 50 years. Okay.
Can you elaborate a little bit on why this boat is going to be so important, type of things it's going to do?
Sure. So we have a fireboat for a lot of reasons, and those reasons involve, obviously dealing with fires along the waterfront. Decades ago, there was more of a waterfront. It was industrial in the city and with hard access from the street side. So a fireboat was really important for dealing with that. As the city's changed over the years, what we have is a lot of use of our waterways. We have dinner cruises out every night. We have water taxis. We also have all the development along the waterfront where those buildings are really only accessible from the backside. So it's important to have a water supply, a big water supply that can support operations along the waterfront, whatever that may be. Also, in the event of some sort of disaster, having the ability to move large amounts of water from the river to other parts of the city through our hoses is really, it's good disaster planning. There's also an ice breaking capability for the boat that is proved useful going back to, it wasn't in place in Air Florida. And that is one of the reasons that boat has a ice breaking design to it. It's these one-off disasters that they happen very infrequently, but when they happen, it's important that the city is able to respond. So the fireboat is in a lot of ways a large insurance policy, but it's used every day. And it is definitely keeps the people that are using the water, the people that are coming here to visit the city, safer.
Okay, thank you so much. I see we have been joined by my at-large colleague, Councilmember Christina Henderson, also a member of the committee. So I will turn to you now, Councilmember Henderson, for a 10-minute round with Chief Donnelly.
Thank you, Councilmember Pinto. Good morning, Chief Donnelly. Apologies for being a little late. I was over at the DPW budget hearing. I understand that you've already talked a little bit about the paramedic school, and we've talked a little bit about that offline. So I'm actually really excited about what that means, not only for the incoming pipeline of workforce that you all have for the agency, but what that will mean for overall healthcare in the city across the board. Let's see. Okay, it looks like this budget creates a new health and safety program in your support services bureau. Can you describe a little bit about your vision for this program?
Are you talking about the, so that it's a renaming of our risk management division to make
Oh,
it a
okay.
broader scope to more accurately reflect what we want. We want to focus on health and safety.
Okay, great. That's great. That's an easy answer of like, we just renamed something. Wonderful. I'm sort of going by the budget book too. So I acknowledge that sometimes the budget book can be incorrect. So these are where some of my questions are coming from. But it seems as though the Emergency Communications Office is moving from the Operations Bureau to the Technical Services Bureau. Is this just a technical change, or is this changing anything about how you all are doing communication operations?
So I believe where our liaison with the Office of Unified Communications lives is moving from technical services to our EMS bureau. And that is to more accurately reflect the challenges of, or not challenges, because that's not the right word. It's getting all the integrated work that has to go on to get the calls right. So there's a classification system that the call takers use that our medical directors engaged in, and this puts it where a majority of that work lives. So that's why it's important. We also have a few employees that liaison officers that work on the floor at the Office of Unified Communications. And since the two of them are focused entirely on where ambulances go and how patients are discharged or where they go for treatment, bringing them under the Emergency Medical Bureau is important for us.
Okay. Speaking of the Emergency Medical Bureau, it seems as though there's a new EMS prevention program. That's
So, yeah. So you have two things there. One is we have an initiative around identifying what our most common sort of chronic conditions are that we're responding to by ward and focusing on getting messages out and trying to prevent those, much like our fire prevention division. The other part of that is what the Office of Medical Director is doing with the opioid response teams. We've expanded our street calls, which focuses on our most frequent users or our people, our citizens that have special needs. Maybe they need help getting back into their house. Maybe there's hoarding, things like that. What we're doing is expanding that to couple them with a social worker who is able, they go out to calls where Narcan was administered, but the patient wasn't transported, and try to connect people with services there. You'll also see a part of that with the Sobering Center, and the Sobering Center coming on board this year will tie in with all of it.
Okay. So how many social workers will you have for that new initiative in terms of?
At the end of the day, we should end up with 4. That's DBH is actually funding those. That money's coming to us through an inter-district.
Oh, I see. Okay. That's good to know. I'll note that. My first part of the DBH hearing is tomorrow. So that's good to know.
We're in favor of that program. Anything we can do to, get some of our chronic callers or people that we're seeing frequently into some other pathways will help us preserve resources for people that are having critical emergencies. They're having problems, but we aren't the solution. And this is helping us build a solution, or at least direct them to solutions.
That's great. So speaking in terms of controlled substances, I noticed within the EMS Medical Director Bureau, it shows that the health, safety, and preparedness and controlled substances programs were being zeroed out. Were those programs just moved to elsewhere in the agency?
So the programs aren't being zeroed. I think they're being moved to Medicaid funds. So you weren't here a minute ago. Yep. We shifted quite a bit of our operating expenses to the grant, to federal funds that is more likely or more accurately described as a reimbursement for costs that we get from the previous year into this year's budget. So in the past, where some of that money had gone, we'd used local funds and that money had gone back into the general fund. This year, we're keeping it, and it has the effect of lowering the amount of local funds the agency receives.
Okay. Let's talk a little bit about capital. My understanding in your capital budget, it includes the project for the relocation of Engine Company 26. Has FEMS identified the location? I understand there was a feasibility study that was done. Have we picked one?
So we have not settled on one yet. There's been some work done on a number of different sites. The latest one we've been doing work on is the one that was talked about earlier over near Channing Street. But that one is still, it's not finalized. There are some other challenges there. So we have a number of sites we're looking at, moving a firehouse, locating a firehouse, even rebuilding in existing places is always challenging. And we are trying to work through that. I have heard, I did hear the caller earlier, Ms. Clausen, talk about ways of community engagement, and we'll try and figure out a way maybe to have the community provide some input there as well.
Okay. So up until this point, as you all have done the feasibility study, that has only been around like, how much land is necessary? Is this a good location from a need perspective around where calls are coming from? It hasn't included community engagement.
Other than the existing processes when we have to talk to an ANC about what certain things would take there, or file for a permit to do something associated with a site. We need to know if we're going to be able to do it. It's also looking for partners. Space in the district is a challenge. And while we probably have enough firehouses, or I think we do, what we don't have is enough space in each of the firehouses. So what we're trying to do is build firehouses that have enough space for now. And when you look at them, some of these firehouses are 100 years old. So you got to expect what they're, try and predict our needs 50 to 100 years out so we can build for those. So we're doing that. I've received a lot of feedback on this process from the community. I haven't had anybody tell me. I did have one group tell me where they would like one. It's in the middle of an industrial area that's a little farther out from our needs than anything else. But I haven't had anybody else tell me. Everybody else who talks to me tells me why the firehouse can't be at any of the proposed sites. And that I understand that. I get it. But I can't provide services without locations. And that is a continuing challenge.
I think you're getting some of the same emails that I'm getting around. It can't be here. And let me tell you the 5 reasons why. And none of them have to do with actually providing care and service to residents of the district, and you all being able to, deliver your mission critical work.
And I do believe some of the reasons they brought up, right? Not all of them are just not in my backyard, right? I think that there have been legitimate questions and legitimate concerns raised in each of by everybody, but it's tough to build a firehouse. I mean, even in places we have firehouses, people don't. We get feedback that, wow, I wish that firehouse weren't there. Can't you move it somewhere else? So it's a challenge all the time.
The project has a proposed 3.5 million in FY24. What do we envision that funding to be used for if we don't have a location yet?
So we're going to have, we need that money to help us find a location and acquire the location.
And to acquire the land. Okay. I am over my time. There she is.
Thank you so much, Councilmember Henderson, and thank you for joining us today.
Thanks, Chief.
So Chief, returning back to the capital budget, I see a line item that zeroes out the $10.5 million budgeted last year for capital work at Engine Company 7 in Brookland. Can you speak to why this funding has been cut?
Chief Hanson's going to answer
Okay,
Run
no
our switch.
problem.
I got it. So I think it's for engine 7. And what that is, DEMPED's leading that effort down there. They've now included DMB as well. So we're one partner in all of it. So I think initially the
They're now
budget was
including who?
building a standalone engine 7 somewhere in the vicinity of our fleet facility, or where engine 7 currently is. And so, we're working with an architecture firm to come up with site plans, working with DEMPED, working with DMB. We've got some site ideas on how we can reutilize that space, but also meet the goal of more affordable housing and mixed use on that property. So all of this hinges on all of it hinges on our new fleet facility being built in Blue Plains, and that's on track. So none of this can happen until we move our fleet facility down to Blue Plains. Once that happens, hopefully everything else will be worked out, and all of the agencies involved, and with DEMPED leading it, we'll have a plan moving forward. Can you clarify this?
So can we expect that the capital dollars needed for that project will be reflected in DEMPED's budget?
I'll stop.
Okay, and also, so that 7 engine is the one at Half and M Southwest. It's not Brooklyn. It's not that's 17 on Monroe Street.
I see. Okay, so engine 7 is the one that will be with DEMPED.
Yes.
Why is the training academy redevelopment study included in the capital budget rather than the operating budget? I see a $6,750,000 allocation for this study, which also seems very high on its face for a study.
So I think that's maybe our portion of the cost. It's a combined process with MPD and that training academy land down there.
Okay.
All of our facility studies and investments in the facilities have come through capital. Historically, I haven't seen one in operating that I can recall. So that seems like a normal process to me.
Okay, and what about that cost allocation? Is that for the study and the project itself?
I'm gonna let Chief Hansen answer again.
Okay.
So in FY23, we're doing a program of requirements. FY24 will complete the program requirements and begin the A&E design for the new building. So that's basically hiring an architect and engineering firm to come in, and once the study is complete and both MPD and we agree what we want for program requirements, they'll basically design it. So that's the fee to basically pay an architecture firm to come up with the plan, which includes cost estimates and things of that nature. So it's pretty extensive when you're doing this type of a project. When you look at the overall cost of it, which we don't know what it's going to be, but combining 2 training academies is a significant investment.
Got it. Okay, thank you. Will any of the administrative fleet vehicles, command vehicles, or other response vehicles funded in this year's budget be electric?
No. Yeah, no. So I don't believe any in this year's budget are.
Okay. Do you know when the new fleet maintenance and logistics facility is expected to open?
We're hoping for FY26 is what we've been told. We seem to be on track for that. So that gets us out of the Southwest Half and M Street location. That's the plan. And I think it'll come along because the other projects are piggybacked on us clearing that space.
Got it. Okay. Does the funding included for ladder trucks support placing a ladder truck back in service in the Fort Totten neighborhood?
No, not at this time. And there's a lot more cost than that. Just the equipment itself. It would be about 30 positions as well. And we'd have to figure that out.
Okay. In an environment in the last several years where we've had more support from the federal government for a number of our programs and budget needs in the city, as we see those either paled back or eliminated, we all need to be really proactive about applying to additional grants and avenues for funding. Did you apply for any grants from the federal government to help supplement your budget?
Yes, we've applied for some AFG grants. I can get you the list of that. But the most important thing we've done in pursuing reimbursement for costs and grants is changing the way we process Medicaid. And we have changed from a $25 million a year operation into something over $65 million. That is a process that we go through annually. We put a lot of effort into it to make sure the costs are accurate and that goes on. That being said, given what the work we've done, we don't expect any changes in that. Say next year, there's some uncertainties in costing and things like that. But the work we are doing there is been way more successful than a $1 million grant or a $100,000 grant that is open to the fire services through other things. The other area that we've been successful is partnering with DBH, say, for these opioid positions. I believe ultimately they are funded from federal opioid money, and that's coming to us for the healthcare work or the social workers. We're not eligible to apply for that type of grant. Those health department grants are not open to fire departments, even though we're a provider. So we have to find partners in that way. So while there isn't a lot of opportunity out there for fire departments to offset their costs. End of the day, that's the reality. And that's what we're working with.
Okay. Thank you. I want to ask you now about 2 Budget Support Act subtitles that I'm exploring, and see if these are things that you would support. One is a subtitle to expand the presumptive disability benefits for FEMS workers to include a number of other cancers that are currently excluded, including colon, multiple myeloma, brain, non-Hodgkin's, throat, kidney, thyroid, and bladder cancers. And as you know, this legislation, the current form, has allowed FEMS employees and their families to access critical disability and death benefits. Can you speak to the importance of these benefits to firefighters and EMS workers? And if we can find the funds, do you support this type of expansion or any other conditions or considerations you would recommend as we're considering this?
Absolutely. I wholeheartedly support the expansion of presumption to include what we've learned since it was first implemented. And what we've learned in the nation since it was first implemented is that firefighters have a higher cancer rate than the regular public because of the nature of their job. And it's certain cancers, the ones you listed in particular, and some cancers that affect women firefighters are not included in our current list. And that removes it changes the burden for the employee. So right now, what presumptive does is when a person has one of those cancers, it means the burden of proof shifts to the department to prove that for whatever reason that didn't come from the job. That creates a lot of stress, that creates a lot of back and forth, and it delays somebody receiving the benefits they need to get better at a time when it's really hard for them and their family. So we support that. We'd like to tie it somehow to a cancer registry that can help us as it's updated, so it doesn't have to come back to add a new type of cancer if that cancer is determined through data to be linked to firefighting. And I think that's important. I also think that we have been up and down in our dedicated funding for this, and that we could probably implement this pretty close to the funding stream that we have. And so I think it's a matter of adding the cancers and then continuing to track where we are. That's important. It's important to our members. I can't imagine a worse situation than getting hurt through the job and not having the benefits you need to take care of your family if the worst happens.
Absolutely. Okay, thank you very much. And that's great to hear about the current funding levels. Okay, and another BSA I'm looking at is for updates to 311, and I'm considering including a requirement that OUC include an option for the public to report any issues they see with fire hydrants. Would you be supportive of adding this option through 311?
Sure, I don't know why not. If there's a hydrant that we've missed somehow in our partnership with DC Water that looks like it has a problem, that seems like a good way to tell us. I think I get some that way already, but I would, yeah, we would support that, I would think.
Okay, great. Thank you. Well, Chief, I want to thank you very much. And on behalf of the whole committee, I want to thank all of the men and women of FEMS for your incredible hard work day in and day out, and putting your lives on the line and keeping us safe, preventing disaster, responding to disaster. I'm excited for some of the investments in this budget to improve the services that you're doing, and I'm excited about the paramedic program. So I look forward to continuing to work with you and your team as we head through this process. I want to give you a chance, Chief, if you have any closing thoughts or any topics you want to highlight that we didn't have a chance to discuss today.
I think my testimony covered everything that I wanted to talk about. I agree with you. Our people are amazing. They're out here doing amazing things every day. They're saving lives. I see reports on stroke care every day. It's super important. We've also we've had a number of significant fires over the last few months, and they've done an amazing job, and they faced every challenge that's in front of them. So DC's bravest have the best. They're amazing. Thank you for your help.
Thank you so much, Chief. Thanks to your team.
Bye.
So this concludes our portion with FEMS. We are going to turn to the Office of Unified Communications. And we will give Director McGaffin a moment to join. Okay, why don't we, it's 11:03 now. Why don't we take a 5-minute recess, and we'll locate the director, and then we'll get started again at 11:08 a.m. with the Office of Unified Communications. All right, good morning.
Hi, good morning.
We are reconvened. We are turning to the Office of Unified Communications. It is 11:08 a.m. on Wednesday, March 29th. So I will turn now to Acting Director Heather McGaffin from the Office of Unified Communications. And as you know, it is the tradition of this committee to swear in all government witnesses who appear before it. So if you could take yourself off mute and raise your right hand. Do you swear or affirm under penalty of law that the testimony you are about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Great. I'd now like to invite you, Director McGaffin, to make any opening statement you may have.
Sure. Just a housekeeping thing. I do have some members of my team that are in as attendees. If they could just be promoted as panelists, our CIO and our financial team.
Gotcha. Okay, we will make sure that's done now. And then after your statement, if they're going to be answering questions, we can go ahead and swear them in as well.
Okay, great. Thank you so much. Good morning, Chairperson Pinto, members of the committee staff, and council members. My name is Heather McGaffin, and I am the Acting Director of the Office of Unified Communications. I'm excited to be here and appreciate this opportunity to discuss the agency's proposed fiscal year 24 budget. As a city, we have spent the last 3 years responding to and recovering from the pandemic. The investments made in DC's recovery plan have translated to more jobs, lower unemployment, more tourism, and the opportunity to experience the very best of what DC has to offer. This FY24 Fair Shot budget acknowledges the economic realities we face by prioritizing the most critical investments needed to make our city a place people want to call home, do business, and visit. I'm immensely grateful to Mayor Bowser for providing OUC with the resources needed to execute its role at the highest level to ensure efficient emergency and non-emergency communications and reliable access to city services and information. I do want to begin by recognizing all of the employees here at the OUC who continue to demonstrate their dedication to serving the public by answering the call. To put this commitment in perspective, last year, our DC 911 call takers and dispatchers handled 1.3 million 911 calls, which is 100,000 more calls than the previous year. On average, each 911 call taker handled 18,309 calls, while also dispatched first responders from MPD and FEMS more than 801,000 times. In addition to processing tens of thousands of non-emergency police reports, we provided life-saving care by providing first aid, CPR, and baby delivery instructions, and hosting text to 911 sessions with thousands of callers. Last year, our 311 customer service representatives handled 1.6 million calls and facilitated the processing of over 409,000 city service requests. On average, 311 customer service reps handled 26,600 calls each last year. We prioritize meeting district residents where they are by maintaining platforms that allow them to request city services in the ways that they decide are most convenient for them. Twitter has become one of our most popular methods of engagement with 311. And our dedicated social media team continues to set the standard for excellence in customer service. In FY24, through our participation in the Harvard Kennedy School's Alternative 911 Emergency Response Implementation Cohort, we will continue to receive the technical support needed to help institutionalize a progressive and more appropriate process in expanding 911 diversion program. This includes our mental health call management, which will increase the volume of calls being transferred to the Department of Behavioral Health's Access Helpline and away from police dispatch. The entire OUC workforce understands the tremendous responsibility of this workload, and we take their role in helping to maintain safe, clean, and engaged communities across the city very seriously. The mayor's proposed FY24 budget for our OUC demonstrates the executive's commitment to ensuring that the agency has the resources it needs to do just that. The OUC's FY24 mayor's proposed operating budget of $59.688459 million is a 2.4% decrease over the fiscal year 2023 approved budget. The operating full-time employees the operating FTEs of 415 represent a reduction of 8 full-time employees, which I must note are non-operational vacant positions from last year. We are pleased to report the investment made in fiscal year 23 budget in the form of additional FTEs for 911 operations enabled us to reduce the span of supervision by adding 5 assistant watch commanders within the 911 division. We are also in the final phase of executing a comprehensive plan to attract and retain emergency operations personnel with these resources, which will include adding staff to shifts with the intent of reducing strain and burnout, which ultimately lead to errors. Further, we anticipate that we will be able to reduce the reliance on overtime. In fact, so far this year, we have established new partnerships and implemented innovative programs with the goal of recruiting qualified staff to fill 911 operations vacancies. We have identified funds and are procuring consulting services to assist the agency with developing and implementing hiring and retention strategies. Also, in addition to traditional means of recruitment for hard-to-fill positions, we also now regularly share our vacancy announcements with public safety cluster agencies in the city, across the region and nation, community action groups, ANCs, as well as with council members. This has served to multiply our reach and the number of impressions and interest in employment with OUC. We have collaborated with DCHR to create a 90-day continuous recruitment and onboarding cycle, and we are in the development phase of creating an attractive incentive package for new employees and referrals from incumbent employees. Currently, there are 39 vacant 911 operation positions consisting of 28 call takers and 11 dispatchers. With this continuous recruitment plan, our goal is to fill all of these current vacancies by the end of fiscal year 24. We intend to integrate these new team members first by supporting non-emergency functions so that they can acclimate with the operations environment and then matriculate through the agency's training academy. The academy consolidates all education, training classes, and courses necessary for the success of OUC team members, providing non-emergency, emergency, and associated support services to district residents and visitors. As part of this balanced approach to adding capacity, to assist with onboarding of these new hires, and to provide professional development for our employees, in FY23, we increased our training staff to include 3 full-time employees who have helped us improve our ability to identify performance challenges and gaps and address them immediately. These team members are essential to the execution of our 90-day continuous recruitment and onboarding cycle. The past few years have been layered with grief, trauma, uncertainty for all of us. Workforce wellness continues to be top of mind as we understand how important mental and physical health is for both incumbent and new employees. When coupled with the intense workload and daily exposure to human suffering as part of our job, there is a cumulative toll that cannot be ignored. For the first time, the agency has a worksite wellness coordinator, and we have engaged a community partner that will facilitate workshops this spring on emotional recovery and strategies for sustaining self when continually exposed to human suffering. We will also continue to identify resources to host additional related programming on site. The proposed 24 budget also includes a capital allotment of $7.1 million to support the replacement of portable radios for MPD and FEMS, construction of the 4D tower, renovation of the Public Safety Communication Center, and for the FirstNet distributed antenna system, or DAS, and the bidirectional amplifiers. There's $2.5 million in our operating budget for the ongoing support of NextGen 911 and related enhanced public safety communication services. To be specific, this funding will provide support for core services, systems, and databases related to the transfer of 911 calls and call data in the National Capital Region, enhanced call routing, and upgraded telephony denial of service management. The proposed budget also includes an enhancement of $400,000 to support OUC's call center workstation enhancement project. This project will involve upgrading 911 and 311 hardware, such as computers and monitors. Mayor Bowser's proposed FY24 budget provides the OUC with the resources necessary to efficiently manage the district's 911 and 311 public safety and public service communications platforms. We appreciate the committee's strong support of our work and I look forward to exploring new ways of providing the best possible service to the residents and visitors of Washington, D.C. Thank you for the opportunity to testify today, and I look forward to answering any questions you may have.
Great. Thank you so much, Director. And thank you for joining me today.
Thank you.
I'd like to begin by asking about the cuts to 911 call taking and 911 dispatching that we see in the budget. Can you elaborate a little bit on what type of impact this is going to have on your operations?
So there is an error on one of the line items, so we will get that fixed. Those are not actual cuts. So we will get that fixed. That's an administrative piece. As far as the cuts, we have 8 that are administrative. There are no cuts to 911 operations or 311 operations. We have the 28 TEO or call taker positions open. We have the 11 dispatcher positions open. And then we have 23 customer service representative positions open and 311. And our focus in this fiscal year will be to hire for those and to get all of those positions filled by the end of fiscal year 24 and using some innovative ways to do that. The only positions being cut, I just want to reiterate, are admin positions that in fiscal year 22 and 23 were added and are just not necessary. Our focus has to be on the operational side, and we have enough administrative staff to meet our goals and our mission.
What type of admin positions are those?
So one of them, or a couple of them were quality assurance officers. And so what we did in alignment with national standards and best practices was all of our trainers are also quality assurance officers. And so we are relying on that kind of streamlined capabilities, those dual capabilities of being a trainer and a quality assurance officer to kind of tackle that. We didn't need 3 people who are just doing quality assurance. We needed people who were capable of doing both, because that's how we operate best here. 2 IT positions were cut, but they do not have a detrimental impact to our team. And then we also cut 1 staff assistant position. That was someone who could just help with administrative work. We have enough team members in those types of roles that we detailed somebody to that position to see what it would look like. And because we couldn't justify a 40-hour work week for that person, we made the decision to cut it.
Okay. So just to confirm, the 16 FTEs that look like they're being cut from the dispatcher and call taker are not
Correct.
right. And then in terms of the vacancy positions being cut, I understand, and we've seen this kind of across agencies in this committee and across the government for the mayor's proposed budget, that there are cuts in vacant positions. But I'm really concerned, especially from OUC's perspective, that are these vacancies that we still need to fill? In other words, just because they're not jobs yet, we still need to be focusing on hiring so that we can get these vacant positions filled. What do you think the right number of call takers and other staff is to safely run OUC?
So for our call takers, with the positions that we have, those 28 open TEO positions and those 11 dispatcher positions, based on a calculation in our industry known as the Erlang-C calculations, once those positions are filled, we will have enough people, right? So today, even though you hear me say like we are short-staffed, it's not because we don't have enough positions, it's that we're having trouble filling those positions. So I'm putting the resources into filling those positions right now versus getting more positions added to our full-time employee, our FTE count.
Okay. Do you have a number that you think is the right number for a fully staffed
Um,
operation?
I am very comfortable and confident that the positions that we have now, once all filled, will be the right number. Because also what we're doing, right now we have our call takers and then we have dispatchers. And over time, our dispatchers who in their position description are also supposed to be call takers. That skill set was not, when we changed protocols from priority dispatch to CBD years ago, that skill set was not offered to them and it wasn't kept up. As we're moving now to power phone and we're getting everyone certified, all of our 911 staff, TEOs, dispatchers, our assistant watch commanders who are our assistant shift supervisors, all the way up to our operations managers will all have that certification and that skill set. So we won't just have a group of dispatchers who are just dispatching. Everybody will be able to be a call taker, because in any situation, the thing that we have to do, if everything were to go crazy, the main function of our agency is to answer the call. In our continuity of operations plans, we have means to get the calls out to fire, EMS, and police, but we have to be able to answer and process those 911 calls. And so we're realigning the positions that we already have so that everybody is capable of doing everything outlined in their position description. And that'll help us, because if we have extra dispatchers on a certain day, if nobody from that squad takes off, we can move them over to call taking and they'll be able to perform in that role. Today, we don't have that autonomy.
Interesting. Okay. That makes sense. I'm really excited about the Junior Academy that you've launched, and it seems like there's already a lot of great buy-in and enthusiasm for the program. Does this budget proposal include funding to support the Junior Academy?
Yes, as part of our community engagement, it does. And so we will continue that in fiscal year 24 and hopefully far beyond, because it is a really great asset. And actually just want to mention that one of our participants will be of age soon to be able to apply for the position and is really eager to do so. So kind of excited about that. Hopefully we'll be able to have a hire out of that academy.
Great. And so is that funding listed under community engagement?
I believe it is. It's listed under the community engagement. And also we've been really lucky to have support from some of our other public safety partners at MPD and FEMS to help support that program. So really, other than some of the things that we're providing, the costs are kind of all absorbed in what we're doing on a day-to-day basis here with our community engagement team.
Okay, great. I see the budget proposal cuts 2 language access FTEs. Is this cut being made because these positions aren't needed?
No, we will continue to hire for the language access call takers, the bilingual and multilingual call takers. I just, I think that this would kind of be a good time to talk about how this works. If I am sitting next to a multilingual call taker, just because I take the call, if that person is already on a call, I can't use them in that role. I'm going to still have to use the language access line. And so as we're looking at how we're kind of realigning positions, we want to hire. Historically, we've had a little bit of a hard time hiring, but the certification, we have a lot of people who are multilingual or bilingual. And so we're focusing on getting them certified as part of the professional development. But we have these 2 positions that if we can hire multilingual or bilingual call takers is great. If not, I would still like to fill those positions, understanding that we have resources to still interact with our non-English speaking callers.
Okay. In terms of the 311 service, the mayor has proposed enhancing the 311 call taking budget by $472,000 and 17 FTEs. Can you explain how OUC determined the need for these additional 17 FTEs and how these additional staff members will impact service? Because it looks like there are still 19 vacant 311 representative positions. So what is OUC's plan to fill the 19 vacant positions and add the 17 additional ones?
So we have 23 open customer service representative positions open. That is actually a mistake in the budget book, and we'll work to get that corrected. This is all happening very quickly, so we have a couple of notes when we review that we'll fix.
I'm sorry, I couldn't hear that last.
Oh, I'm sorry. There's that is actually a mistake in the budget book, and so we have 23 open customer service representative positions.
Okay.
Not 23 plus 19. So we will make sure that that error gets rectified.
But the proposed budget adds 17 new positions. Is that an error?
I'm going to turn it over to Kipling Ross to kind of better explain that, council member.
Okay, great. And I'll go ahead and swear you in and any other members of your team who are going to be answering questions. If you can all take yourselves off mute. Do you swear or affirm under penalty of law that the testimony you are about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
I couldn't hear.
I do.
Thank you. Okay, so go ahead. We're trying to understand the 311 FTEs.
Okay, good morning. So with respect to the 311 FTEs, those 17 they're actually 911 call takers, and that adjustment needs to be made. We'll work with our OCFO to have that those positions moved back to activity 2010 911 call taking. So it's actually not an enhancement to 311. 311 still maintains the same FTE level. You see a reduction of 16 911 call takers. That's the offset that needs to be fixed.
I see. Okay, so we were talking about earlier how 911 will not be impacted.
Yes.
It's not an enhancement, it's just a continuation of those 16 positions.
That's correct. So the positions, for whatever reason, were loaded in the wrong place, those 17 or 16 positions. So that'll be corrected. It'll be switched back from 311 call taking to 911 call taking.
So then the 311 call taking will not have any increase, but there are still 23 vacancies which are maintained in the budget for you to try to fill?
That is correct.
I see. Okay, thank you. If you all can follow up with the committee once those pieces are updated, that would be very helpful.
Absolutely. Well, thank you.
Thank you so much. Okay, so for training and quality assurance, and I know this is something, Director, we've talked about on a number of occasions, I'm very concerned that it looks like quality assurance is being cut by over $1 million, $1,054,000, and 10 FTEs, which leaves only $280,000 and 2 FTEs for quality assurance programming, when this was previously funded at $919,000 in FY 2022 and $1.3 million in FY 2023. Can you explain why this cut was made?
So I'm going to turn it back to Mr. Ross here.
Okay.
Okay. So the shift between quality assurance, you actually see those positions, they're just were reallocated to the training department. So there's still quality assurance specialists, but those positions are actually budgeted under training at this point. So you see the shift of the -10 in quality assurance, and then the increase in training of 12. And then we added to the training division with 2 additional FTEs.
Oh, I see. Okay. And are those positions, are the 10 positions all filled?
I believe they are filled.
And then you'll have the ability to hire an additional 2 within training, which will be part of quality assurance, just listed under a different title.
That's correct.
Okay. Yeah, I think it would be useful if we could see the crosstabs for all of these moves, because it, as has come up already on a number of occasions this morning, it looks like major shifts are happening in personnel. And so if that's not the case and it's just a budgetary shift, that will be helpful to know.
So this is kind of a little bit of like what I was talking or kind of mentioned earlier, is that in 22 there was this idea that quality assurance would be separate completely from training. In national standards and best practices, those two kind of go hand in hand, because we do the quality assurance assessment, and then that information, those trends that are found there, those errors that are found there, those have to go back to training. And so during late 21, quality assurance was moved out of our Office of Professional Standards and Development and was put in 911 operations. But that shouldn't be the case. It should really be back with the training team. And so now the trainers and the quality assurance team all are collaboratively working together, and a lot of them are doing dual roles as to not do burnout, and to be able to kind of take what they are seeing in those quality assurance assessments and developing training that's that really pinpoints the things that we're finding out in quality assurance. And so that's why we moved that. We've done some work. We've talked to the team that was here during the audit, and we all agreed, and I think it even mentions it in the audit, those things should be together. And so we've put them back together. And so on line items, I know it looks a little funny maybe, but we're not cutting our quality assurance program. We're not cutting our training program. We've consolidated and made them more robust and more responsive to our needs here.
Okay. So just to make sure I got this, for the 12 new FTEs for staff training, those are just recoded essentially from the quality assurance staff, which are the 10 current plus 2 new.
Yes.
Okay. And that won't affect, will that affect any of the FTEs that you currently have budgeted in the staff training?
No.
Okay. Okay. The budget includes $400,000 for 911 emergency call center workstation upgrades. What will this work entail specifically?
So that's for the hardware, the computers, the monitors. Those are on about a 3-year life cycle. I mean, they are used 24/7. And so we will be replacing those so that they're, in kind of a proactive effort, right? We do this every 3 years so that we don't have workstations breaking down in the middle of calls or things like that.
Okay. And will this allow you to upgrade all computers or just the ones that are on the end of their life cycle?
All. Everything, we try to keep everything on the same life cycle so that we're doing it all at one time.
And how many computers is that? Or workstations?
300.
Okay. The budget proposal includes an $81,570 reduction to call taker recruiting incentives and a $50,000 reduction to call dispatcher recruiting incentives. I know this is something you and I have talked about in the past, Director, of how important recruiting is to make sure we're building up a pipeline of folks to do these really important jobs. Can you explain how this reduction will impact OUC's ability to recruit new call takers and dispatchers?
It's a one-time reduction, but also we've kind of shifted some funds to focus on recruitment and retention. So I don't foresee us having any sort of issue. We're not going to have to really reduce what we're doing. It was funding that was in there, funding that we didn't use because we had some other funding sources that we could kind of pull from to recruit and do recruitment and retention from.
Okay, and what funding sources are those?
I'm going to pass it over to Kip. Sorry.
Yeah, thank you, Director. So The funding in FY 23 for hiring incentives was one-time funding. And so in 24, we would have to identify funding from our SPR fund or even vacancy savings, right, to fund in hiring incentives going forward in 24.
And how much did you spend on those incentives in FY 2023 so far?
We haven't spent any of that money in FY 23 so far.
Okay.
I believe we still have a hiring class to go, and so that there will be opportunity for some hiring incentives to spend some of that money in FY 23, as well as any referrals that come up from our employees that would help to expend some of that funding.
Okay, I'm just trying to understand if we're in agreement that we need to spend this money for recruitment and incentives, then why not list it under recruitment and incentives?
We can look at that and kind of realign it so that it's kind of trued up. Because of the leadership changes in this past fiscal year, there have been some things, and I've been working, and our CAO have been working with DCHR, because all of those types of incentives have to be approved. There are limitations and different things, and so working to really come up with a stellar, attractive plan has been a goal since February to kind of get that going. And so there's that. The money that we didn't spend in 23, that we haven't spent yet, but we will be spending. We have this one-time reduction. And then also there's that in the mayor's budget, there's that separate pot of money for those hard to fill positions. I think it was like $2.5 million. I think that it was that. And so I submitted and it was accepted. And I think even in the presentation, it noted 911 call taker. So that TEO position, that entry level position here at OUC is included in that.
Okay. And yes, that $2.5 million through DCHR could be an avenue, but I'm worried on your behalf because you'll be competing with other agencies who are also having staffing challenges. And so, they have their own needs, but with an OUC perspective, I want to make sure you all have the specific recruitment and incentives that you need to get your staffing filled.
Thank you very much for that. We really appreciate it. I'm really confident in our conversations with the mayor's office that hopefully we're high on that list. But I'll continue to to kind of push for that, because it is important, especially as other public safety entities here in DC and across the region are now also offering incentives, including some 911 centers. So I think it's also important to note that just in the past 2 weeks, I've opted to participate in a nationwide compensation and incentive study with other large cities. So with our participation, we'll get the feedback from that. And so we'll certainly share that with the mayor's office and with your office, council member, so that we can kind of see what things are looking like for like-size centers across the nation.
Okay, great. And in terms of other public safety jobs, there are different recruiting avenues, strategies, and different people sometimes. But for particularly OUC, DOC, FEMS, and MPD, are there any coordinations of efforts going on to demonstrate and go out and share all the different options for public safety careers with folks that we can do in a more coordinated fashion?
So yes, actually, I've had a recent conversation with our deputy mayor, with Chief Donnelly, and mentioned it to Chief Conti, that here at OUC, we have a lot of the same requirements that those agencies have, except we don't have a physical requirement. You don't have to climb a wall. You don't have to drag 150 pounds. And so those folks that are recruiting for those jobs and may need a little more time to be proficient in those physical aspects. I don't have a physical requirement here at our agency to hire. So working with those agencies to kind of give an alternative, like, maybe right now in this point in time, this isn't the case, but we have this great agency that supports us, and here's some recruiting information for them. And so I'm kind of reaching out to that level. We've actually had some people just on their own come to us, so we'll have that presence. We have the stronger presence in DCPS, because not everybody wants to be outside in the front lines, right? And so we're here, it's a climate controlled building all the time. And so we're trying to attract people and really have this profession be seen as just that, a public safety profession, so that we can kind of get, I don't think people think about it. And I think I've told my story that I never thought about it, right? And that was 20 years ago, and I'm still hanging around. So just trying to get people into this profession and really highlight it is really our goal. But also in my testimony, I noted that we had a little bit of funding that I'm able to hire a consultant, a national 911 consultant, to come in and help us, because we don't have all the answers here, right? And so we know that recruiting is an issue, and that program will really focus to kind of recruit, help us retain. And, we just really are trying to highlight the great things that we're doing. Yesterday, the 911 staff from the Dominican Republic was here. And so our staff got that exposure. They got to talk to call takers from another nation. And so we're offering a lot here that our other agencies maybe in the country or in this region aren't, don't have that same exposure. And so we're really just trying to make this a great and fun place to work, and really let the staff know that are working here today, and the staff that we're trying to attract, that you are really making a difference in the lives of residents and visitors. And it's an important job, and we want to have people on our team.
Thank you so much. I completely agree. It's a very important job. And I'm glad to hear that there are some more conversations happening with some of this coordination. And don't leave out the Department of Corrections as well in that mission, with some additional vacancies that we see there. So the budget proposal includes a pot of $2.5 million at OUC. Sorry, we've talked about this already. That's okay. But in your application, or if you've either filled it out or are going to, for that DCHR money, how much will you be applying for?
We are going to look, those are some conversations we're having with DCHR. Right now, with the pot of money that we have, that's our own pot of money, there are stipulations on how much you can offer a person. And I believe it's like 10% of what the salary is. And so that's about I think that's between like $1,500 and $2,000. And what I'm doing is we're looking at the region to see what other centers around us are offering, because if that's low or that's not going to make an impact, then we need to make the case to and provide some justification about why we need it to be a little bit more. So those are ongoing efforts. I don't know that, I can justify some of the larger sums that maybe we're seeing in different places, but I certainly want to make it attractive and worth somebody's while to come out and apply and go through the rigorous training process.
And where does that 10% limitation come from? Is that district law? Is that your own policy?
No, that's district law.
Or just OUC?
I don't know if it's not OUC specific. I think because of where our agency falls in things, that's what we are being told we can offer up to 10%. But we are currently working on that. And as soon as we have some more clarity, or, if we provide justification, we'll let you know what that looks like.
Thank you. The fiscal year 2023 budget included a $100,000 allocation for one-time funds for recruitment incentives for new call takers, mirroring the incentive programs that we see for other first responders. How have you made those incentives available this year? And has it been helpful in your efforts to recruiting new call takers?
So the class that started in February will be the first class that we are going to offer that incentive to, because that money was made available in October and we didn't have, there was a class that had just finished up. So this is our first hiring class of this fiscal year. And so that's kind of where we're working on now. We will give them something. There will be some sort of bonus. It's just what that amount looks like.
Okay. And, you know, I know we talked a little bit about building the pipeline and exposing people to this type of really important work. But what do you think are the most critical hiring and recruitment incentives to address the vacancies that we see and encourage our best folks to stay long-term at the agency?
Sure. So I think one of the things to get people here is really highlighting all the things that being a DC employee means, right? There's good benefits, there's housing allowances, there's different incentives that they're eligible for. I think as far as getting, you know, the other part of getting people here, and certainly the part of keeping people here, are the career pathways that we're building out. And so one of the things that we did when I first got here in 2020, and at some point we abandoned, and that we are definitely bringing back, is you know, a career pathway. Sometimes people come here, they don't really know what 911 is all about. They don't understand all the inner workings of 911. And so just yesterday, or just on Monday, two of our one 911 employee and one 311 employee became IT employees here at the Office of Unified Communications. They had a desire to learn more about the IT part of 911, and our CIO and his team, you know, really embraced that. They help teach them things. They provide training that they can take that would help them really better understand those programs. And so allowing people to really grow where they are and promote and establish that career pathway early on is really important, because 30 years of call taking is hard, right? And 30 years of dispatching is hard. And we have a lot of employees that have done that and are doing that. But we want to also encourage them to do other things if that's what they want to do. We also have a lot of people who come in through 311 from DOES programs or other special programs, and, you know, encouraging them to kind of find their way and kind of map out what their vision is for themselves is really important to us. And I think it's one of the things that really sets us aside from other 911 centers.
Thank you. So turning to the capital budget, there are a number of capital projects in your agency's budget that look quite similar on their face, touching on upgrades to IT equipment, radios, and other hardware. Can you provide us with a breakdown of these different projects and why they're important to the agency's functionality?
Sure. I'm going to turn it over to Teddy Cavalieri, who's our CIO, to talk about those, because they are all touching IT.
Okay, great.
Hey, good morning.
Good morning.
So I think since the creation of the OUC, one of the benefits of consolidating communications for public safety has been the benefits of lessons learned. What we do for Fire EMS benefits, MPD benefits, Department of Corrections, and all the public safety agencies and other agencies like even DDOT and DPW have benefited from those investments and lessons learned and support program that has been in place. Currently, OUC supports a little over 8,000 radios for the district. Majority of those are for MPD and Fire EMS. We also provide services for the mobile data computers that are in the vehicles for MPD and Fire EMS. We provide about 1,200 of those devices on top of what we do for 911 and 311 for the agency. So this was a consolidated support for all the public safety entities and some city services like 311 and applications that support 311 intake, sending that down to the partner agencies, DPW and DDOT, and a tightly integrated solution. The investments in our computer-aided dispatch system benefits not just OUC for 911 call taking, but all the way down to MPD and Fire and EMS for the response. So when an event is created, an incident is created in CAD, it goes down to a responding agency for MPD, Fire and EMS in the vehicle. So they can update their status, they can have closest unit recommendations for CAD. So the closest units can be recommended for these incidents. All of that is integrated into this overall public safety support system that is OUC. So it's not just supporting 911 and 311, but these expanded services. Just to give it at a high level, over a 10-year period, we have a replacement life cycle that's about $100 million. That includes all of the radios, all the mobile data computers, all the switches, routers, 911 gear, 311 workstations, all of that. If you know, every 10 years, we look at spending close to about $100 million on an ongoing basis. And that is funded separate from the 911 fees. This is all capital expenditures. So from an IT perspective, it's not just supporting the OUC's internal 911, 311 services, but all of these other entities. You know, collectively, we support close to 25 agencies when it comes to radio communication, 311 services, and things like that.
Got it. Okay. Thank you very much.
You're welcome.
Director, the budget for the IT and communication upgrades project has a new allotment of $2.75 million in FY 2024. This is a master project that includes a number of radio and communications sub-projects that some of what we just talked about. Can you share what this new funding will support, what the total cost is of the project?
I'm going to give it to Teddy to
Sure.
talk. Thank you.
Yeah, there are a number of capital projects that subdivided, and the biggest one in FY24 is the replacement of all the core network switches. We try to replace those every 10 years. So last time we did it was 10 years ago. So that's about $2.345 million and allotted in FY24.
Okay.
The other projects, we have additional monies for the PSCC renovation. That is a continuing renovation. That's about $2 million. We have other radio site work that's being done. So there's a tower that is being replaced at the 4th District, the Eiffel Tower, call it. That one has been in the works for a number of years. But since then, we have other radio sites that have also been requested to be moved for different reasons. The Reeves building is going to go through a sale and a major renovation. So we're moving that infrastructure to another site. UDC, the building where we housed our radio equipment, that is also being relocated. So the other project funds not only the radio tower at one location, but the 3 other sites. So it's a combination of those. So in fiscal year 24, that's allotted about $2.7 million. I believe those are the big items for FY24 when it comes to IT infrastructure and systems capital budget.
Okay, thank you. But as I look at this year's budget, the agency has a $1.9 million balance in this project already. So could we use the nearly $2 million balance to cover most of the cost?
No, so this is it's not reflected in encumbrance, but it's already slotted for these projects. One of the challenges we've had over the last number of years is just getting through the procurement path, getting putting together the bids so that we can get the bids in. And then some of these projects require a design before we can put out a bid for the construction side. And that has taken a lot longer than expected. So we are going through the process of getting those lined up. And I believe even for the 40 tower, we are at the 75% design. So we got a little bit of work left to make sure that the design part of it is done. The design includes what is required for an RFP. Once we get that, then the RFP goes out. It's taken close to 6 months to get an RFP completed, getting enough vendors to bid on it, review the bids, and then let OCP make the selection. So it has taken a lot longer when it comes to these capital projects than we've experienced in the past. We've seen, and not only that, not only just the procurement process, even once it gets awarded, because of the supply chain issues we're seeing out in the industry, we are expecting delays in projects of getting a lot of these projects implemented. all the way down to radio equipment. Things that used to take us 3 months to get, it's taken us 9 to 10 months after the contract is awarded. So the supply chain issues that's affecting, you know, at the global level is also impacting the public safety, the things we do in public safety. Not just the IT part of it, but the construction part of it.
Right.
So what you see, the balances that you see, a lot of it is reflected on what has happened. One, getting the procurement through, but the second part of it is getting a design completed. So it allows us to put out a bid for the completion of the project and things like that.
So you anticipate that those
Just to add
funds
one
will
more,
be drawn?
yeah, just to add one more thing. Just to give you an example, we have one of the projects we're working on in the collaboration with DGS is replacing the generators at the UCC. I mean, the vendor is telling us at a minimum, it takes a year once a contract is awarded to deliver a generator. I mean, these are the kind of delays that we haven't seen in years in the past.
Right. And so is it accurate to say that you expect that the current fund balance will be drawn down for the continuation of these projects?
Yes, absolutely.
that's
All of
separate.
what you see, maybe a few dollars here.
Hold
and
on,
there,
sorry,
but
that, and that's
already allotted
separate.
for projects. And in
Excuse
some
me, Mr.
instances,
Cavallari.
depending on what,
Hello,
depending,
sorry, can you hear me?
yes,
I just want to make sure that's separate than the funds that are allocated for these same projects in future years.
yes.
Sorry, go ahead if you had another point to share.
Yeah, and then one of the things we're seeing because of supply chain delays, sometimes vendors are coming back and telling us, you know, price increases. If a contract is not awarded by a certain date, there's an estimate we put in at the beginning of the project or at the beginning of the procurement process. Some of these are taking so long, they're coming back with 15-20% increases in certain instances. So we're hoping that, you know, what we have budgeted doesn't have to come back with a major increase, but we're seeing those.
Okay. And on the MPD and FEMS radio replacement project, this project has a slate of funding from FY 2025 through 2027, which suggests that the funds will support a specific capital project rather than a number of projects on a rolling basis. What will this specific funding support?
In FY25, about $11.1 million will be supporting the replacement of the mobile radios for MPD and Fine EMS. So the first batch of funds that we have, close to $30+ million, took care of the portable radios. The portables are the radios they carry. The second batch is replacing the mobile radios for MPD and Fine EMS. And then in FY26 and 27, we start replacing secondary agencies, Department of Corrections, PSD, Homeland Security, HCMA, maybe one other agency, but those will start replacing those radios in FY26. All of this is based on replacement life cycle. For the portable radios, we schedule them every 10-year replacement. For the mobile radios, we can extend them between 12 to 15 years, depending on how much use that they have in these vehicles.
Okay. Okay. Thank you. Well, that concludes my questions for you all. I want to thank you and your whole team, Director McGaffin, for all of your work, and all of the staff at OUC for working so hard every day to keep district residents safe. We're excited to work with you in the committee for continued investments and quality assurance and training improvements and staffing, as well as the recruitment pieces that we've talked about. I want to give you a chance if you have any closing thoughts or want to share something that we didn't have a chance to talk about today.
No, I just, you know, for anyone watching, we are hiring, and so it is a great place to work. And I just want to, you know, thank you and your entire team. This has been a great working relationship, and I look forward to that continuing. And also, you know, to the mayor's office for all of their help. You know, our goal is really to just do right every single day when we answer the call, and to really highlight the things that we're doing here so that people think about this when they think about a career in public safety, you know, or just as a public servant to our city. So thank you for your support, and we will be in touch with those follow-up items. Council member, thank you so much.
Sounds good. And I'll be sending a I heard some echoing. I think it was just me. We'll be sending some written follow-ups as well.
Okay, great. And we will get those back to you. Thank you so much.
All right. Thank you so much. Thank you to everybody who's joined us this morning. There being no further business before the committee, the time is now 12:02 p.m. on Wednesday,